For over 2 years now, the world has struggled to get a grip of COVID-19 restrictions, travel bans, vaccinations, and a number of other moves have been employed to try to contain the spread of infections. But unfortunately, none of these measures have successfully put an end to the ravaging pandemic. Nigeria, just like other countries, have experienced spikes in cases, numbers, and a drop as well. Right now, the country is dealing with the fourth wave, and the mutation of the virus resulting in different variants has meant that scientists are yet to fully comprehend the disease. This is why safety measures introduced appear to be the most reliable method of stemming the spread of COVID-19. But many people have gradually abandoned these safety protocols. Joining me to talk about this via Zoom is Julie Mogbo, Health and Wellness Consultant. Julie, good morning. Thank you for joining us on TVC Breakfast.
Good morning. Nice to be here.
Right.
Happy New Year.
Same to you. That's true. Now, just when we are trying to get a hang of the Omicron variant, we are seeing another variant, Deltacron, coming up again, and a lot of persons are wondering how this are we going to live with this for a long time? What the situation is, we are vaccinating, yet we are not seeing the virus abating. What we are seeing is continuous mutations.
Yeah, thank you very much, Veronica. Well, it should be expected when we have situations like this, like a global pandemic. What we're going to be seeing are consistent mutation of the virus. So this is not strange, and people should not panic. I would say it's expected from the beta to the delta to Omicron, and now we're having this. So it is not unexpected. We've been having this or battling with this for close to 2 years now. I think we should be looking for ways to tighten up our infection control methods, ensuring that we are keeping up with the safety protocols in order to prevent further or more severe outcomes than we have already recorded.
But at some point, the issue was that if we have a particular percentage of a population vaccinated, we wouldn't be faced with all of the mutations that we're seeing. And we know that a majority of the Western countries have got those numbers, yet we still see them witnessing this mutation. And that brings the question of the efficacy of these vaccines to the fore.
Well, the efficacy of the vaccine is one thing, and then the other thing is for us to bring to remembrance that there are no experts when it comes to COVID-19. The scientists, records have it that they are still trying to understand what this particular virus is. So we are having need to engage in constant research to better understand the virus and how to contain it. So we would have these things happening because we have no experts yet. It is when this has gone for a period of time, then maybe many years after, we can now start speaking as a form of authority because this has been experienced before. So it's not totally strange, one. Two, we shouldn't be panicky about it. Three, there are different climes, different situations, different body systems, different responses to hazards and events around us. So it is expected for this to happen. Like I said, there are no experts, and research has to continue. Talking about the viability of the vaccine is a totally different story. We need to constantly engage in research. And also when we have researchers in different health institutions obtaining data from patients, from clients, our own part will be to cooperate with them, because if we don't have data, we will not be able to come up with authentic outcomes of research.
Now, what kind of impact are these new variants we are seeing coming up going to have on the pandemic, especially on the curve? Because at some point we thought it was, going down, and then we are beginning to see these variants.
Well, so long as there's a decline and there's a relaxation on infection control systems, mechanism, policies, and all that, and then on the individual part, if we do not keep up to fight a pandemic and to bring it to a complete halt, we cannot rest on our oars. So if we don't keep up with the safety measures, precaution that we need to engage in, whether at home, in public places, there are certain policies that have already been put in place. If we do not, like I said, we have different systems and we respond differently, uniquely to illnesses, to diseases and infections. We cannot tell how the next person is going to respond. So everyone just need to play their own part, the organizations, institutions, then individuals in homes, different places. Let's keep to the safety protocols. Interestingly, regardless of the different mutations that we are currently experiencing, the measures remain pretty much the same. It remains the same. That seems to be like the only constant thing. So I think we should just keep at it, and perhaps we'll be able to reduce the effect of this recent variant.
Now, you've been talking about cooperating with government. We see that a lot of persons are still very hesitant, and some outright refusal to the compliance with the safety protocols, as well as also perhaps taking the vaccines. And some have said that perhaps our approach in terms of risk communication is the major issue here.
So there is one part about miscommunication or not communicating as effectively. We need to have constant engagement with those in authority. They cannot have a gap in communication, whether it's the information agency. We need to constantly hear from the disease control, the disease control organization. We need to constantly hear from the government. Let's know what is being done. If we have hospitals, institutions that have their database where they communicate with patients, this information should go on. I like the fact that on websites, on social media platforms, whenever there is the mention of COVID-19, there's a caution there where you can click on and get information. But then not so many people will go through the trouble to click to get updated with what is going on. So it is advised that there should be different means or the various means used to communicate this information to people. That is on one part. Then secondly, for those who have experienced COVID-19, have had to be admitted or isolated one point in their life or the other, you find out that if they once upon a time did not believe in it, they come out kind of aggressive, especially when they come in contact with those who still are living in ignorance or would not adhere to certain preventive protocols. We have come across people who don't want to wear the mask, they want to make excuses that they cannot breathe, they have certain conditions and all that. But if these same people read the news, read information about this, they will know that it's pretty much safe to still wear the mask. So we don't want to wish people this illness, but there are some celebrities who have encountered COVID-19 and they have come out to say that you have to experience this. I think you need to experience this for you to understand how severe this is. So we need to have constant communication on the part of the government. Policies need to be put in place. If we have to put control measures, that also has to be effected. And there should be consequences for those who do not adhere to safe preventive protocols. And then for the individual, self-governance is key. We really can't pick up cane and start flogging people around, but we need to understand that if you are healthy, you are strong, you really do not know how healthy your neighbor is. So it's best for us to just adhere to the preventive protocols.
Right, and that's a fine place to leave this conversation this morning. Health and wellness consultant Julie Mugbo, thank you so much for your time on the program.